Post-op dental implants instructions. The following instructions are procedure-specific and accompany the post-operative home care instructions. The post-operative course for dental implants typically involves very little swelling or pain. However, if pain or swelling is present, it will usually subside after 3 to 5 days. If you have persistent swelling or pain after the second week, please call the office. During your procedure, your dental implants may be covered with your gum tissue or exposed, visible post. Covered implant. If your implant was covered, please avoid chewing in the area and refer to the post-operative instructions brochure. A covered implant will require a simple exposure procedure, which will be reviewed with you in the coming months. Exposed implant. If your implant is exposed, you will see a silver post, implant temporary abutment, appearing through the gum tissue. The exposed silver abutment portion is a temporary component that will eventually be replaced by the implant crown. On occasion, the abutment may loosen or come off. If this occurs, call the office. Please follow these additional instructions. Avoid hard or crunchy foods in the area. Pressure from chewing hard or crunchy foods can cause implant movement or pain. If this occurs, the implant could become compromised and may require removal and replacement. Begin brushing the exposed silver abutment portion 1 week after the procedure. Initially, it is common to see some bleeding of the gum tissue with the beginning of brushing. Usually, this will subside after 2 days of normal brushing. Implant or abutment movement. If the implant begins to move, please call the office immediately. Pain may be present with implant movement. Removable temporary tooth. This may consist of a flipper to replace one tooth, several teeth, or a complete, temporary removable denture. The removable temporaries have been adjusted to eliminate pressure on your implant or implants. Please keep any removable temporaries in your mouth for the first 2 days and nights. Therefore, if swelling develops, this will not affect the temporary. After the swelling subsides, the temporary should be left out of your mouth at night. Care instructions for the removable temporary should be provided by your dentist. Any adjustments in your bite or any adjustments required for additional comfort will also be managed by your restorative dentist. You will be followed closely throughout the post-operative course. Before your dentist can begin fabricating your final implant crowns, an implant stability check will be completed. This occurs 3 to 4 months after your implant procedure. Fixed temporary tooth. Your dentist may have fabricated a temporary tooth that is attached to the implant. This temporary is purposely adjusted to look short so that it will not make contact with any other teeth. This temporary is only for appearance and not for biting or chewing food. Because this temporary is made of plastic, it may fracture or come off. Should this occur, call your restorative dentist immediately.